Can explain all this on her. What I like to do when a patient's kind of sitting up in the upright position is kind of take advantage of this and mark out what I see from a surgical standpoint. So first of all, the axis of where I'm going to be doing her brow lift. So that's one thing. Then as she's sitting up here, I'm kind of looking at her hairline, and I'll go ahead and mark the incision for the brow lift. And then I'm going to reconfirm that when she's lying down, just in case there's a little change in the hairline placement. So it's just kind of double checking 3 times type of thing. The next thing that I really like to do is mark out where I put my fat. I do think that this changes a lot. When patients lie flat on their back, it changes the position of the tissue. So I'd like to mark this out so I know exactly where I'm marking the fat. This line right here demarcates the deep plane entry point. So this is just some anatomical lines. Now, this patient here has a phenomenal angle of mandible here. I mean, like, this is like textbook here. So this is one thing that we definitely during our facelift want to accentuate, make sure she maintains that contour, so she maintains that really nice, sharp jawline. I palpated submandibular glands earlier on her, marked those. Then I like to mark my position of the neck incision, and then also where my proposed area where, for example, when I'm doing my neck lift, this is going to go in like that. So that's my proposed point of where my division line for in my head looks like. Last but not least, what I like to do is, if we look very closely at her neck, okay, the lowest line that she has is right around here. So we're going to try to dissect somewhere in this, up to this region, just to release that so it looks nice and smooth. So the actual facelift incisions, I can mark that with her lying down, which is not that difficult for me, but the things that I need to see her upright for, I like to mark. Oh, and last but not least, I marked out my key points on her lip. Those are key anatomical points, and as I get going through the case, I will go make some detailed measurements in the operating room and then figure out how much I want to take or all those kinds of things. This modality is the blue light modality, and hey, Pearl, describe what it feels like.
It feels very warm, like I'm sunbaking and relaxing.
Exactly. So I've tried this before as well, just to see what it feels like, and it really feels kind of like sitting at a beach with the sun directly on you. It feels very, very relaxing. What it's actually doing is this wavelength of light is killing all the little microbacteria that live on the skin, so that it reduces the incidence of infection. So even though the incidence of infection in facial surgery is extremely low, might as well do something simple that can even reduce that even further. So that's why we went ahead and utilized it. It's included as part of our Elixir therapy protocol.
Yeah, I love it.
I know, you feel like you could stay there all day, don't you? Yeah. It's very addictive. Sometimes you feel like just lying underneath there and just chilling. So today's patient's kind of a very interesting patient. I should say every patient's interesting, but things that I am really looking forward to, things that I'm a little cautious about. Overall, patient's anatomy is phenomenal. I mean, she's got this sharp, sharp mandible. It's a lot of just laxity and loose skin, so I think she's going to get a phenomenal result. So all of the what I call the little factors that you're looking at to predict results, she's going to look fantastic. She's got super thin skin. Again, poses its own challenges. Partly it's a plus because you'll see phenomenal definition. It's a negative. You have to be very careful. Every little flaw will show. So it's just really a very, very exacting, specific type of surgery. So I dig it. I love it. So I'm psyched. I'm pumped. So I'm ready to go crack this. Go ahead and put our plan for the day on here. So so far we've injected fat. So next order of business is going to be to do lipo. Then we're going to do fat transfer. Then somewhere in there we're going to have to inject brow 1. Then we're going to inject brow 2. Then we're going to do our brow lift. Then I think this is the point at which we're going to take a little break. Then let's go look and check upper lid. Then we're going to do inject face, neck. Then we'll check to see if she needs a break. Then we'll do face neck. Then after face neck, what are we gonna do after face neck? We need to, no. We need to check and see if she needs lower lids versus laser, okay? Then we're gonna do upper lip and then chemical peel. Did I get everything? Brow, yeah. Lid assessed. So the questions we have to check on are whether we're doing an upper lid, what we're gonna do, what with the lower lid, okay? Anything else? After looking at her, those are the things that I need to address. And of course, the happy face, because no happy face, no surgery. 4, so it's 10 minutes. I'm gonna wait for another 10 minutes. I'm gonna take the Cancun sun off of you, let you chill for a little bit, so therefore we're not burning through your eyes and giving you a headache. That way it'll really set in there, and then we can kind of come back and we'll get some good fat, okay? Actually, you know what? Well, yeah, we'll do it that way. So before I go ahead and inject, before I do my lipo, I'll go ahead and block me. So remind me, I'll just go ahead and block for her medial brow. That way that can set while I'm doing my lipo.
Yep.
I really cannot ask for the surgery to have gone any better. So anatomy, perfect. Perfect patient, anesthesia was perfect. I mean, she's got a jawline that can really just, not just cut glass, but maybe cut diamond. I mean, it looks sharp. So I'm super uber excited for her response when she sees it tomorrow. We made a couple of modifications inside the surgery. I thought I was gonna do a lip lift on her, but we got such a lift from the facelift portion. I think she would have looked unnatural with a lip lift. So we just put some stem cells in there and did a very strong chemical peel, and I think she's going to be very happy with that, and it's going to be very balanced and natural, because she was very, very anxious about a lip lift and it being overdone. So I think this is the best of all worlds, and she's going to end up loving it. So super excited to see her tomorrow.
My jaw's great. It looks so different though. It's swollen. I look windswept, but that will go away, right?
Correct. That's from the dressing and being pulled.
But yeah, I have a heart-shaped face now.
Exactly.
Beautiful jawline.
Look at the neck.
Yeah, oh wow. That's great. So you know how I look different now? Will I look more like myself?
Yeah.
Yeah, I just look different.
It's hard to tell because you haven't seen yourself and you're kind of, all lifted, but just once the swelling subsides and it kind of loosens a bit, you'll start looking, probably in about 4 more days, you'll start looking a lot more like you.
Okay, great. All right, thank you.
All right, so first, I'm gonna get all up in your grill here. I'm gonna turn you just a little bit this way. Let's go ahead and mark our fat. So, we've got sister number 2 today. First of all, sister number 1 did great. She's a little puny this morning just from having a pretty big surgery. The primary portions of this surgery, I think, on her are going to be just the facelift portion and the fat transfer. Fat transfer is going to be a little challenging on her just from the standpoint she's a very, very slender individual, so finding fat, and she's actually got more volume loss, especially in the temporal regions. So this is going to be probably one of the more challenging portions of the case, but other than that, I don't foresee anything really off the wall. The cool things that I'm really looking forward to is just the vertical elevation, because yesterday we saw this, the amount of vertical elevation that we got and how it changed the dynamics of the lips, so we didn't have to do a lip lift. And I think the same is going to happen today, so which I think is going to be pretty cool. So really looking forward to that, and we'll see how it goes in just a few hours. All right, so basically we're done with our case. Let's see, as always, we have a few modifications that we need to make intraoperatively. So for this patient, the questions that I had in my head were whether or not I was going to do a lip lift, and with the facelift, she got a very nice kind of lift of the corner of the mouth so she doesn't have the downward turn, and she has a decent shape of the lips. I don't think it's necessary to do any additional work on her lip because she wants a very, very natural look. This is her aesthetic. She doesn't didn't want an overtly done look. So I think it's best to respect that. My main concern preoperatively was the fat. It was a bit of a tough thing to get the fat, but we accomplished whatever we needed from a fat perspective. Complications, she had Radiesse before that was injected to the face, so she did have Radiesse injected right at the entry point for our deep plane entry point. A little bit of additional work in trying to dissect that because the Radiesse does scar the tissue planes. Other than that, the surgery went fantastic. She's been cruising, and anatomically, surgically, I couldn't have asked for anything more. So I think now it's just a waiting game and see how everything heals, and I'm very optimistic that she's going to be completely content, happy, and thrilled, but her result looks amazing.